Good morning. My name is Patrick Munene. I'm the Vice Chairman of the Health Committee in the National Assembly of Kenya. I'm also the Member of Parliament for Chuka-Gambangombe constituency. I'm accompanied with members of my committee, Health Committee. On my right, I have the member for Mwea constituency, Honorable Mbeere North. Then on my left, I have the Women MP for Samburu, Honorable Pauline Lengulis. We also have our staff. Today we are visiting this particular hospital, the Chest and Skin Clinic in Esiara, as a committee from National Assembly, from Parliament, because we have been carrying out an investigation on fraudulent claims by hospitals from NHIF, because we realized as a country we had lost a lot of money through fraudulent claims by hospitals. And when the NHIF audit was released, we realize that as a parliament we can't rely on that report until we go on a fact-finding mission ourselves as parliament on the ground. So we have been visiting hospitals that were in that list, not this hospital only. We have another group of members of parliament who are in another part of this country. So we have not singled out this hospital only. We are visiting hospitals that were in that list. From here we are going to Nkobo, to Jekim, and also on a fact-finding mission. We found the proprietor here, Dr. Libogo. He has been cooperative. His main accusation was that he got money from Edwafia. Edwafia is the insurance that was covering students unfairly. They said he influenced students to come to this hospital. He received so many students that raised eyebrows. But we have engaged him. We have found the facts that the mistake was only 2 students that were not in the system out of all the students he had seen. And he has explained himself that the problem was the system, and he admitted that the system missed the 2 students, but they are in the hard copy of his register. So I'm not saying we have cleared him, but we have had a side of story. Because if somebody is accused, we don't want to table a report in parliament and accuse you when we have not had your side. Because members of parliament will represent also the owners of hospitals are also Kenyans, so we represent them also. We represent the government. We don't want the government to lose money. So that's why we came here today. We didn't come to close the hospital. We came in a fact-finding mission. And this main accusation, it's good also to be clear so that people don't say parliament committee was at Bogo was placed and said he is unqualified. We didn't come to accuse Bogo of being unqualified. We came because there was a problem with the Edwafia insurance, the one that covers children. He was accused to have influenced students to come to this hospital. So we would want that to go to media and very clear so that we don't destroy people's businesses or destroy people's reputation and names. We didn't come here on malpractice. We didn't come here on malpractice. That is not our work. The work of malpractice is done by KMPDC. But as parliament, what we have decided that from what we have seen is that there is a mix-up in registration of hospitals in this country. Because the same organization that registers doctors, all doctors in this country are members of the KMPDC. They pay money to become members. It's like a club for them. But the same KMPDC is the one that registers and regulates hospitals. So they come to see their colleagues. So when they come to see Bogo's hospital, they are coming to see their colleagues' hospital. So we want to recommend as a committee that we need to separate the registration of medicine as a profession and the registration and the supervision of facilities. Because when they are done by the same group, then there is a conflict of interest. You can't be Alif Ali who left us his own team. If you left the same team you coach, then there's a problem. You favor your team. So that's what has been happening in this country, and as a committee we have realized that, and we'll recommend to parliament that we need to separate legislation of doctors as a profession and legislation and regulation of facilities, so that it can be done by 2 different groups, so that we can always checking who. Like what happens in the Ministry of Education. Schools belong to Ministry of Education, but the teachers belong to TSC. That was to avoid a conflict of interest. But now in the other sector, there seems to be a assuming parliament on 13th. I think we're assuming parliament on 13th, and that's why we are doing this trip across the country, because we expect this report to be on the floor of the House. As we go back, immediately we go back, this report will be on floor, because one, patients are suffering because institutions that were stopped from admitting patients who use NHIF, those patients are suffering because we know most of our people rely on NHIF. So we need to sort out this problem. If an hospital has a problem, you close it once and for all. If an hospital has no problem, you create to continue with their business. Because some places we have gone to an hospital and they tell us, here we used to have 4 daily employees. Now we have sacked all of them. So as a parliament also, we represent those people who went home. They are Kenyans. So we want to expedite these things. So I can assure you that this session, before we end this session, we are going to Parliament. This report will have gone through the House and we'll have made our recommendations as a full House.